Okay, as we are done with the extrinsic and intrinsic musculature of the larynx, now we will discuss the motor innervation as well as the sensory innervation of this voice box. So the muscles we just have discussed, first we'll talk about the innervation of those muscles. There are two sources, two nerves. If you remember in the beginning, when I was discussing the developmental anatomy of the larynx, I talked about the pharyngeal apparatus. And the fourth and the sixth pharyngeal arches are giving rise to the larynx as well as the pharynx, the cartilage and the musculature of both tubes. Okay? So keep in mind that the nerve of the fourth and sixth arch is common. It's the 10th cranial nerve or the vagus nerve. So vagus nerve gives off two of its branches to supply the larynx. Alright, so just behind me on the board there are a couple of drawings which are showing us the larynx with its musculature from different angles. Okay, alright, so have a look at this drawing first. This is a lateral view of the larynx and pharynx showing us the muscular tube which is known as pharynx and the cartilages of the larynx. One of the muscles of larynx is visible. Then these are the membranes which are completing the laryngeal framework, the thyroid membrane and the cricothyroid membrane. Below the pharynx is the esophagus. Below the larynx is the trachea. Okay? Now come back to the nerve. So as the vagus nerve has been given off by the brainstem, it's coming out of the cranial cavity and it's descending down into the column of neck. While it is descending down, because it's the longest cranial nerve and it will go up to the level of abdominal cavity below the diaphragm. So while it is descending in the column of neck, it gives off a branch just above the larynx. Okay? That branch is known as the superior laryngeal nerve. The superior laryngeal nerve, if you remember, is the nerve of the fourth pharyngeal arch. It supplies the structures which are derived from the fourth pharyngeal arch. The nerve, the superior laryngeal, once it has been given off by the vagus, you have to imagine that the vagus is traveling, it's descending down, and the branch has been given off higher up above the level of larynx. Superior laryngeal, it splits into two. The moment it has been given off by the vagus nerve, it splits into two branches. One stays outside the larynx and the other passes through that hole which was present in the thyroid membrane on either side, a right and a left hole for the passage of the neurovascular bundle. Remember? So that nerve, which is a component of that neurovascular bundle, is this internal laryngeal branch of the superior laryngeal nerve. That has nothing to do with the structures which are located outside the larynx. It's the nerve which is going to innervate the inside of the larynx. Okay? At this moment we are not talking about the internal laryngeal branch of superior laryngeal. We are concerned with the external laryngeal branch of the superior laryngeal nerve. The external laryngeal branch is going to provide motor innervation to the constrictors of pharynx. So we have the superior constrictor, we have the middle constrictor, and a part of the inferior constrictor is also getting its innervation from the external laryngeal branch of the superior laryngeal nerve. Apart from that, only one laryngeal muscle, intrinsic laryngeal muscle, gets its innervation from this branch of the superior laryngeal nerve. That is the cricothyroid muscle. If you remember, this is the muscle which is taking origin from the anterior arch of the cricoid cartilage. If you remember, anterior arch of the cricoid cartilage, the muscle is taking origin and it's ascending and it's inserting at the inside of the thyroid lamina on either side. So we have a pair of cricothyroid muscle, and if you recall the action of this muscle, it was supposed to increase the length of the vocal cords or the vocal ligaments. So when we use high-pitched voice, or we are having a high-pitched, singing something or whatever, so that requires the lengthening of the vocal ligaments. This is the responsibility when the muscle will contract towards its origin. It will pull the vocal ligaments and it will lengthen the size. Okay? So the cricothyroid is the only intrinsic muscle which gets its innervation from the branch of superior laryngeal nerve, which is the nerve of the fourth pharyngeal arch. The branch is the external laryngeal nerve. After supplying the constrictors of the pharynx and the cricothyroid muscle, the external laryngeal nerve is done. Alright? What about the rest of the long list? We have a long list of intrinsic musculature of larynx. So, excuse me, there comes the role of a second nerve, which is this predominantly the motor innervation of the intrinsic muscles of larynx. The recurrent laryngeal nerve, which is again a branch of the 10th cranial or the vagus nerve while it is descending down. Okay, so here first I will ask you to focus on this drawing, and then we'll move on to this drawing, what this nerve is doing. And then also we have to understand, because it's a very important nerve, much more important than the superior laryngeal. Okay, superior laryngeal is supplying just one muscle. The recurrent laryngeal is supplying the rest of the muscles. And also it has some surgical significance, so we'll discuss one by one. Recurrent laryngeal nerve, it travels within the groove present between the esophagus and trachea. So this is known as a tracheoesophageal groove, and we have one groove on either side. So we have a pair of recurrent laryngeal nerves climbing up from the thoracic inlet. They are climbing up towards the neck, back towards the neck. That's why they're known as recurrent. And they are supplying the larynx, the musculature of larynx, so they are known as the recurrent laryngeal nerves. Okay? They are the branches of right and left vagi. Okay? So the nerve travels on either side of the trachea and esophagus, which are the midline tubes, in the tracheoesophageal groove. And if you come to this drawing, have a look at this. This is the inferior horn of the thyroid cartilage, which was making a joint with the cricoid cartilage, the lamina of the cricoid cartilage. This is known as the Cricothyroid Joint. So the nerve passes behind the cricothyroid joint. Well, I was talking about the recurrent laryngeal nerve. So that recurrent laryngeal nerve, this nerve, it's climbing up, reaches up to the level of cricothyroid joint, passes behind the joint and enters. So if my probe is the recurrent laryngeal, it's passing behind the joint, cricothyroid joint, and it's entering the inlet. Okay? Or you are viewing the larynx from behind when you have removed the pharynx, and you are able to see most of the intrinsic musculature of larynx. Okay? So you can see the recurrent laryngeal nerve, it's giving off branches to the posterior cricoarachnoid muscle, which is the only abductor of the vocal cords. The only abductor. The rest of the muscles are helping in adduction, approximating the two vocal ligaments. The only muscle which is responsible for the abduction or opening of the glottis is the posterior cricoarachnoid muscle. Okay? Before, by the way, let me mention one thing. Before entering behind or passing behind the cricothyroid joint, it meets this muscle. The recurrent laryngeal nerve meets this muscle. This band of muscle, remember, it's the cricopharyngeus muscle or cricopharyngeus muscle, whatever you feel like calling it. Cricopharyngeus muscle, it's the only component of the pharyngeal constrictors. It's a part of the inferior constrictor muscle. Okay? So it's the only component of the constrictors of pharynx which is not innervated by the external laryngeal branch. It's innervated by the recurrent branch of the recurrent laryngeal nerve. Okay? So after giving a branch to the cricopharyngeus muscle, the nerve passes behind the joint, cricothyroid joint, and then enters and supplies the rest of the muscles of the inside of larynx. that excludes the cricothyroid muscle. So we have a list. We know that the posterior cricoarachnoid muscle, a pair of lateral cricoarachnoid muscles. Then we have the interarachnoid muscles, or which is also known as the transverse arachnoid muscle. We have the oblique arachnoid muscle, which are also known as airy epiglottic muscles. Then we have the thyroepiglottic muscle. Then we also have the vocalis muscles. All of these muscles are getting their innervation from the recurrent laryngeal nerve. Okay? So you can understand how important this nerve is. If something happens to this nerve, which is pretty common, that will lead to the paralysis of the vocal cords. The vocal cords will be in a constant state of, immobility. Okay? This nerve is not only providing motor innervation, but it is also assisting in the sensory innervation. We'll just talk about it in a couple of minutes. But before that, I really want you to pay attention to something which is known as the course of the recurrent laryngeal nerves. So move on to this drawing. Here in front of us is the drawing showing us the front of the neck. Okay, so you can see this glandular structure is the thyroid gland, one of the biggest endocrine glands located in the column of neck, just in front of the tracheal rings and just slightly below the level of the thyroid cartilage. Okay. Other than this thyroid gland, I want you to look down there, which is showing us the arch of aorta. Okay. So if we talk about the level, the vertebral level, it's like, let me review it with you, that the larynx finishes, or the trachea starts at the level of the 6th cervical vertebra, while then it keeps on coming down till the level of the 4th thoracic vertebra. If we talk in terms of the anterior landmarks, we have the manubrium sterni and the body of the sternum. There is an angle between the manubrium sterni and the body of sternum. That's known as angle of Louis or sternal angle. Okay, it's at the level of T4. If we correspond it with the vertebral level, it's at the 4th thoracic vertebral level. Okay, so at the level of the 4th thoracic vertebra, from the left ventricle of heart is originating the arch of aorta. Okay, or the ascending aorta, which is transforming into the arch just behind the angle of Louis. Okay, so all the way down from neck, we are now talking about the thoracic cavity. Okay, why? Because it has some relevance to the recurrent laryngeal nerves. Here you can see that the arch, from the arch of aorta, 2 vessels, like 3 vessels altogether, have been given off. On the right side, because this is the right side of the body or the neck, thorax, this is the left side, because we are looking at it from front. Okay. On the right side is the brachiocephalic trunk, the right common carotid and the right subclavian. They originate in the form of a single stub or single trunk from the arch of aorta. Okay, known as the brachiocephalic trunk. Okay. So this is the right subclavian artery and the right common carotid. On the left side, there is a left common carotid and the left subclavian. Okay, so that's about the vessels which I have sketched over here. Now come back to our recurrent laryngeal. The recurrent laryngeal nerve, I told you that it has been given off by the vagi, the 2 vagi. They are descending down. They reach the thorax, and what they're doing, they are making a plexus along with the sympathetic fibers and everything, and those plexuses are the cardiac plexus, the bronchial plexus, because the vagus nerve is one of the most important autonomic innervation, source of autonomic innervation of the viscera, organs of the body. So it has to make plexus, right and left vagi. The moment they reach the level of the heart, the vagi, just they recall that we have to give off branch to the larynx. So these recurrent laryngeal nerves have been given off. The branches have been given off by the main stem of the vagus on each side. Okay. Now look at this. On the right side, the level of the right recurrent laryngeal nerve is slightly higher than the level of the left recurrent laryngeal nerve, because the left vagus keeps on descending down, and it crosses the arch of aorta. Just below the arch of aorta, it gives off the left recurrent laryngeal, which just winds around, it loops over the arch of aorta and climbs up back into the neck. While on the right side, the level is slightly higher. The right subclavian is the cutoff point. The right vagus is descending down, and then just once it crosses the right subclavian artery, it gives off its right recurrent laryngeal branch, which climbs up. So we can say that the level of right recurrent laryngeal is slightly higher than the level of left recurrent laryngeal in the thoracic cavity, okay? Or rather in the mediastinum, okay? Right, now come back. What is happening here is, I was talking about the course and the relations. So the recurrent is traveling on either side in the tracheoesophageal groove. This is the trachea, and on either side of the trachea are the two lobes of the thyroid gland. The tips of the lobes are reaching to the level of the thyroid, the lower part of the thyroid laminae on either side. Okay? So what happens that the recurrent laryngeal nerve is traveling up, and it goes behind the thyroid gland, is still traveling within the groove between the trachea and esophagus, and then passes behind the cricothyroid joint. Okay? So here it's traveling along with the vessel that has been given off by the first part of the subclavian artery on either side. Okay? That the thyrocervical trunk is been given off by the first part of the subclavian artery, and one of the branches of the thyrocervical trunk is the inferior thyroid artery. As you can see, the inferior thyroid artery has been traveling towards the thyroid gland, to the lower poles of the thyroid gland, and will supply the gland. The inferior thyroid artery also gives off a branch which is the inferior laryngeal artery, which will supply blood to the larynx. Okay? There is a very intimate relationship between the recurrent laryngeal and the inferior thyroid artery. And we have to understand, while performing a thyroidectomy, any surgical procedure on the thyroid gland, the surgeon has to be extra careful while, handling with the lower lobe of the thyroid gland, that the vessel is, when he's clamping the inferior thyroid artery, he has to be extra careful not to sever the recurrent laryngeal nerve, which is just passing side by side, because it is traveling within that tracheoesophageal groove, and it's been accompanied by the inferior thyroid artery. Okay, so in case of the damage to the recurrent laryngeal nerve, if it's been unisided, like unilateral, there would be paralysis of the vocal ligament or the vocal cord of that side, and also the muscles, and also the sensory, the mucosa of the larynx of that side. Okay, if there is a complete thyroidectomy and there was a carelessness involved during the surgery, there would be damage to both of the recurrent laryngeal nerves. That will lead to the complete paralysis. The patient will not be having any voice anymore. Okay, he won't be able to move his vocal cords or produce any sound from the larynx. Sometimes what happens, there are tumors of the thyroid gland, which is pretty common in females. So that tumor can compress over this nerve. Okay, so I wanted you to understand this close relationship between the inferior thyroid artery and the recurrent laryngeal nerve. Okay, while the superior laryngeal nerve is the branch of the superior laryngeal nerve, which was the internal laryngeal branch, had been accompanied, it's been accompanied by, okay, the superior thyroid artery. The laryngeal branch from the superior thyroid artery is known as the superior laryngeal artery. That will be traveling along with the internal laryngeal branch of the superior laryngeal nerve. It's tongue twister. That makes the neurovascular bundle. So we have the internal laryngeal branch of the superior laryngeal nerve. We have the superior laryngeal branch of the superior thyroid artery and the vein. They are traveling like a neurovascular bundle, passing through that hole present in the thyroid membrane. Okay, so why the external or internal laryngeal branches of the superior laryngeal nerve are not in much danger. Why? Because most of the times the surgical procedures have been performed over the thyroid gland. Okay, and the thyroid gland is way more away from the superior laryngeal nerve. It's mostly related to, it's like closely related to the recurrent laryngeal nerve. And that's why I really wanted you to know the course as well as the relationship of the recurrent laryngeals right and left. Okay? Now, as far as the mucosa or the sensory innervation of the larynx is concerned, we know that, if we come back to our model and we are looking inside, because the mucosa is the inner lining of the larynx, okay? Remember, these were the vocal ligaments or the vocal cords, the white color bands, and the green color bands, it should be like this. The green color bands were the vestibular ligaments or the vestibular folds, okay? So, the mucosa above the vocal folds or the vocal ligaments is supplied by the internal laryngeal branch of the superior laryngeal nerve, which is not a muscular branch. It's not a motor nerve. It's a pure sensory branch given off by the superior laryngeal nerve. Okay? It will supply the mucosal lining above the vocal folds. That will include the inner surface of the epiglottis. Okay? The mucosa covering the inner surface of the epiglottis. All the vestibule, remember I told you that the area above the vocal folds or the vocal cords is known as the vestibule of larynx. Okay, the vestibular folds will be supplied by the mucosa covering the vestibular folds will be supplied by the internal laryngeal branch of the superior laryngeal nerve, and also the ventricles. Remember I told you the space between the vocal fold and the vestibular fold is known as the laryngeal ventricle or laryngeal sinus, or the sinus of the larynx. Okay, so we're done with the vestibular region or the mucosa of the vestibule of larynx. Now what about the mucosa which is covering the vocal ligaments, making the vocal folds, and the mucosa lying below the vocal folds? Okay. I told you that this region below the vocal folds is also known as the infraglottic region of the larynx, and the region which is lying above the vocal folds is known as the supraglottic region. That includes the epiglottis as well. Okay, so I was talking about the innervation of the infraglottic region, which includes the vocal folds. So the mucosa of this region is supplied by the branches from the recurrent laryngeal nerve. Okay, so we can say the recurrent laryngeal nerve is a mixed nerve. It has the motor component, which is dominating, but it also has a sensory component, which is supplying the mucosal lining of the vocal folds as well as the infraglottic region. Okay, while the internal laryngeal branch of superior laryngeal nerve is a purely sensory branch. It has no motor component. Okay, now we can imagine that if a damage occurs to the recurrent laryngeal nerve, what would be the extent of effects? There would be paralysis of the muscles of that side, or if it's a bilateral damage to the nerve, there would be complete paralysis of the intrinsic muscles of larynx excluding the cricothyroid muscle, and also there would be complete loss of sensation in the infraglottic region of the larynx. I hope that you have understood this map of the motor as well as sensory innervation of larynx. I think we are done with it. The next topic would be some of the clinical correlates of the larynx that involves the larynx.